our ongoing discussions about mental health and mental illness, and how the fact that we all have some sort of degree of mental illness or mental health that we need to be working on. Before I get started, though, I want to address an interaction I had from my previous broadcast with a gentleman who took grave exception to me and my style, calling me all kinds of names, which prompted me to ban this person from my page. But then in retrospect, I started thinking, maybe this person will calm down and engage with me and discuss what his issue is with me and the way I do things. So I unbanned him. If he should tune in tonight and wants to be civil, I'll be civil. If you don't want to be civil, I won't be civil, because I'm not going to allow people to just say whatever they want to me without me responding in kind. So if you want to be kind, if you want to be cordial and professional, feel free. So I unbanned him, and if he tunes in tonight, great. But I did take a minute to check out who he was, and his Facebook page says, "I am not a therapist, but if you need advice." So I think that's where he had an issue, because I continue to champion the idea that if you're getting mental health advice, you should be getting it from somebody who has some sort of training and some sort of background in the field. Because yes, I do believe that this is a science and this is a methodology of helping people. And if your only training is, I once had a toothache, so now I'm in a position to give people mental health advice or dental advice, it's the same thing. I'm not saying that people can't be empathetic and listen and connect with people, of course. But what I'm saying is, if you want to work on your emotions, if you want to work on your trauma, if you want to work on things that plague you, then yes, you should find somebody licensed in the field to give you that advice. Apparently, this gentleman had a problem with that. So if he should happen to log on during this broadcast, won't mention him by name because that's not my style. But warning, if you come at me in a rude way, I'll come right back at you. Anyway, so let's get right to, hi, everybody. Allison, how are you? Christine, thanks for tuning in. Please share this. Please share this. I want to lead off with, hey, Christine, going to lead off with your question. So Christine posted on the previous broadcast, as far as depression goes, because it can become so overwhelming, what modalities could you recommend, some aside from psychotropic medication? I just can't tolerate CNS stimulants for ADHD. No problem for the length of the question. She did go on to say that she appreciates not being scolded. I would, be interested to hear if you're being scolded by your mental health professional, then, that mental health professional needs some counseling. But so Christine, great question. One of the main foundations that I use in my work is what's known as cognitive behavioral therapy. So cognitive behavioral therapy is basically the preeminent form of therapy, because it has been scientifically validated and it can be replicated in multiple forms. So what CBT is, if you think about it, what cognitive behavioral therapy is. So my cognitions affect my thoughts, my behavior, cognitive behavioral. So within cognitive behavioral therapy, there is a subset of interventions called the ABCs of thinking. And I've talked about this before, and I would encourage you guys to look into this. But the ABCs of thinking are activating event, belief, and consequence. So what that means is we get activated by something. Something happens, something affects us either internally or in the outer world. So what happens is we then put a belief upon that activating event, and then that activating event has consequences in the form of feelings. So what I would recommend you to do is to look at your belief system. Look at how your belief system is affecting your feelings, because what happens is, Christine is saying, I'm very familiar with cognitive behavioral therapy. So that's the main one. Another one you can do if you're looking for different modalities is something called existential therapy. So existential therapy is where you're looking at the whys of who you are in a broader sense. You're looking at like, what am I? Who am I? What am I? And there's a great writer out there named Viktor Frankl. And Viktor Frankl wrote a great book called Man's Search for Meaning. And he wrote that book in a Nazi concentration camp. And he found that people who lose their meaning, lose their purpose, those are the ones who end up having the most problems. And what that means is that even within an environment like a concentration camp, he began to notice that the people who held on to a meaning, found something to do, found something to give them purpose, those are the ones that endured. So there are other forms of therapy where you look at your past, you look at how your past is affecting you. You know, Christine, I don't really know exactly what is going on with you. You know, I haven't had a chance to chat with you, but if there's something that's continuing to plague you, then you need to look at how those beliefs got instilled in you, because part of what working with a person like me, a mental health professional, is that you can take time to talk things out of you. And you're going to hear that mantra with me, because yes, I do believe that, you know, looking at videos online or listening to a speaker or going to a conference or where somebody's talking, those are all good. Courses, those are all good. But what they're missing is the ability to talk things out, to be able to say to yourself, what is going on with me? How is this affecting me? And talk that out. Okay. So, you know, I would be I would want to know, you know, why are you being scolded, or why are you being, you know, why do you feel that your therapist or whoever is scolding you? That is definitely something that should not be happening. You should feel an alliance with the person you're working with. You should feel a feeling that person's in your corner. Again, guys, please share this. If anyone's watching this live, shoot me some questions, please. The way this works best is if we're interacting. So Christine is saying, and I'll get to you a second, Allison. Christine is saying she likes analyzing myself. I definitely miss my job and becoming very depressed and not useful and no purpose. Okay, Christine, so good. So what I would recommend to you is, if you're going to work on that with somebody, or we can do a little bit right now, is identify why your job gave you so much purpose. Like, maybe you need to branch out a little bit in your world and find things that give you purpose, find things that give you more meaning. You know, we do live in a culture where we stress job. You gotta work. And so and with this whole coronavirus, is a lot of people have lost their jobs. So they're like freaking out, like, what the hell do I do now? So, you know, if loss of job is affecting your depression, your happiness, then that could be money. Obviously, if you don't have a lot of money, that's going to affect how you feel. But I'm sensing from your question that it's more like you don't have something to do. You don't have an identity anymore because you've lost your job. So, you know, that gets into a whole bunch of, yes, you're saying it's difficult being bedridden and alone. Absolutely. So that will definitely affect your mood. You know what I mean? And by the way, guys, please, if you can put notifications of when I go live so you know exactly when I'm on, that would be great. And please share this. So yes, that is going to affect how you feel within yourself, because if you're bedridden and you can't get out and you can't get up, then that is definitely going to affect how you feel about yourself, and not only how you feel about the future. Sorry, I'm just looking up a question that somebody asked me that I want to get to. So we need to look, Christine, I would encourage you to look at what you are telling yourself about being bedridden, because and don't get me wrong, being bedridden, you're not going to be, oh, great, I'm bedridden. Oh, wonderful. No, that sucks without a doubt. You can't go out. You can't do anything. But I would offer to you that there's got to be a way that the negative aspects of your life don't need to consume you. Now, I say that, you know, I've been through my share. I had something back in March when all this coronavirus, I went to the ER twice. And I don't get sick. So I know what that's like to be very, you know, down and feeling sick. So Christine, what I would encourage you to do, sister, is look at what it is about being bedridden that is affecting you. And now she's saying, oh no, I'm very productive in this bed. Beautiful, beautiful. So that's great. So that tells me you're gaining some control over the being bedridden. Wonderful. Okay. So back to other modalities you can use. There's EMDR. EMDR is a way that, you should really look into that. I'm not an expert in EMDR, but there are some interesting papers coming out that the way it's implemented by a professional can help. I don't know much about EMDR. I don't practice it, so I'm not going to sit here and act like I'm an expert. But what I try to help people do is really get into who they are. What is affecting them? Why do they feel like the gentleman I was referencing to earlier, to grave exception that I don't know anything about substance abuse treatment. And I would offer to him, how many treatment facilities have you worked in? I've worked in several. How many hours of clinical practice do you have? How many clients do you have? There's a big difference between, I learned the AA model and now I'm an expert. You need training. You need to be working with people. I've worked with hundreds, thousands of people who some love AA, some don't. Some like the middle ground. But AA followers think that is the only way to get clean. I'm not going to get into that debate at this point because I don't want to get sidetracked here. We got a lot of questions coming in, and I want to get to some of them. So, Christine, I hope that helps. I'm a happy camper and always helping others. Beautiful. You're monitoring how your emotions are affecting you. I get an emotional paycheck. Is that the light blinking treatment? Yeah. Well, yeah, exactly. It has something to do with your eyes and blinking. And yeah. And again, what I'm being told by people who some like it, some think there's nothing to it. So, let me just go back up here real quick. Get to Allison. How do you change a flawed belief system? Great question. So Allison, what I'm hearing in this question is that there's something about your beliefs. There's something about who you are that is affecting your feelings. So your beliefs are affecting how you feel. The first thing to do, great question, by the way, but the first thing to do is to look into, what are my beliefs? What do I believe? I like using racism as a great example of conditioning. There are no born racists. I know people who are hardcore racists believe this is who they are, but that's not who they are. You learn that. So a racist who is motivated to look at his or her belief system can absolutely affect the degree of their racism. Somebody who's not motivated, they're not going to look at it. They're going to look at somebody like me and like, dude, that's psychobabble. So what I would encourage you is to identify, what are you believing? So if you're still on, Allison, what part of your belief system you feel is flawed? That's the first question I would ask you is what, I have a sister that has a flawed, it's your sister that has a flawed belief system. Gotcha. So I'm guessing that your sister is doing things or operating in a manner that you don't believe, or you think she could be doing better, that she could be being more productive. That's difficult because, if the person doesn't want to look at their belief system, then they're not going to change. I've got members in my own family who refuse to take my advice and look at what they're doing, and they want to, put it back on me and say, dude, save that for your clients. But a person who doesn't want to look at their belief system is not going to look at their belief system. They're not. Okay. So what I would encourage you to do with your sister is try to find out okay, so she's saying, my sister believes God is responsible to find her husband. So basically what I'm hearing you saying is you believe in the idea that you can't just wait for God to do everything. You got to be out there. And one of the, I definitely believe in a higher purpose or a higher power, so to speak, meaning that we're part of something larger. But religion, I'm not saying all religion's bad or get rid of a religion, but I find a lot of times people lose sight of the ideas of God, of what that unifying aspect is, and they focus on religion. So my idea is God helps those who help themselves. So, sure, she believes God overlooked her. So if you believe that if you're feeling that way, and again, guys, please share this so we can bring in some more people. Remember, conversations about mental health, mental illness, There's nothing to be ashamed of. If you're going to have conversations with your friends or family about your physical health, your dental health, whatever health, having Botox, whatever it may be, you need to have conversations about your mental health with and not be afraid to talk about them. So please share this, okay? I'm going to be lining up guests over the next week or so to have people come on, providers come on, and I'm going to interview them. But if you're watching this, if you're new to this, please submit a question. Okay, please. This is only going to work if you guys are interacting with me, because the whole purpose of this is to show that talking things out is the way to go. We have to move from a society of people holding everything in and talking things out. Okay, that's an important part of it. So what I would say to Allison is, she's saying she blames God or is a cause for all and she has not accomplished. So what I'm thinking, Allison, is you're kind of looking at your sister like, honey, it's not God. You can't blame God. You can't keep externalizing your control into God's hands. You've got to be able to own the fact that you need to do the work. How do you help her? You try to impress upon her that she needs to take more control of her life, that's what God wants. I just have trouble believing that God wants us to be, what we learned as little kids of God is the shepherd and we are just the sheep and we have God, I like to think of we're God's hands and we need to be doing that work. So how do you help her? Try to engage with her in a way that she doesn't feel judged, but in a way that helps her see that she needs to be more proactive in her own healing. So what I would ask you, Allison, is why is this bother you so much? What is this stirring up in you? So she's saying, I agree with you. Great. But what is this stirring up in you with your sister? Have you guys always had problems? Is this something that, you've always sort of had this kind of underlying tension with each other? Is your sister gone off? Has your sister had addiction before and now she's kind of addicted to religion and addicted to God? These are all the things that we need to keep looking at. So one of the things I would encourage you guys to think about when you're trying to help other people is, why am I doing this? Why am I needing to help this person so much? What is going on with me where I need to change this person or save this person? So she is moving from the West Coast to the East Coast near me. Great. Well, that gives you more of an opportunity to connect with her. But Allison, I would ask you, if you can't help her, what does that mean? What does that mean to you if you cannot help her? So if you can't help your sister, you can't help her, then where are you with that? Does that mean you've lost respect for yourself? Or does that mean you're feeling like what's the point of going on? You got to look at what's motivating you to help this person. And if you can't help them, then what does that mean to you? What does that mean if you cannot help this person in your life? And don't get me wrong. I understand. I understand how much we want to help people. I've got people in my own family that I wish I could help. I wish I could help get them on track. But for whatever reason, they are either not ready for that or they look at the help as something they don't need. And then when they look at it that way, then they're not going to get help. So they're not going to get themselves in a position where they can help. And remember, anyone just tuning in now, we are having discussions about mental health, mental illness. So she's saying she envies my life. Well, what does she envy about your life? Why is she envying you? What is going on with her where she's jealous of you, or there seems to be some issues there that might need to be worked out. But what I'm encouraging everyone watching this to do is to check in with themselves Why do I need this person to get help? I'm sorry, I'm just looking up a question that somebody had submitted before. What is going on with me that I feel the need? Remember, one of the powerful things about this work is you look at yourself, you look at your motivations. Why am I doing this? This is what we as providers go through when we're being trained. We have to do work on ourselves. We have to work through some of our own issues so that we make sure that they're not. Okay, so you're saying she's childless, she's unmarried, so she's looking at you like, I don't know, maybe she's envious. I don't know if you guys have always had some of the sibling rivalry or animosity or whatever, but I would recommend to you, Allison, and thank you for engaging, because this is what this process is about, is suppose you can't help her. Suppose you can't change her or make or heal her. Then what? That's what I would recommend you thinking about. Like, what would happen if she can't do it? So Rose is interacting and asking how old. That's a great question. But one of the things I would encourage everybody watching this is to get into where they are within themselves. And Allison is actually asking, how do you deal with envy? Great question. Let me pause on that because I want to get to somebody else who asked a question from a previous video. How do you stop, and I'm going to come back to you, Allison, and whoever else wants to chime in. How do you stop thinking about the past? Okay, great question. How do you stop thinking about the past? Well, you can't. Okay, that's the bottom line. We are evolving, constantly learning people. So if I said to you, how do you forget how you learned to read or write? You can't. The past is always exerting an effect on us. So Janice asked this a few in the last video. The key, though, is when you're talking about the past or feeling the past, is how is it affecting you? One of the things that I mentioned this before, one of the things people don't like to admit is that their past is still affecting them. People don't like to admit that. People don't like to admit that I'm still being affected by the past. We're all being affected by the past, people, okay? All of us. Denying that is why you're stuck, because the more you're denying that you're being affected by the past, the more the past is going to affect you, because it's going to act like if you had a cut on your arm. And I did a video that's gotten 16,000 views or whatever a few years ago about how to heal emotional wounds. And one of the ways you deal with an emotional wound is you deal with it like a physical wound. You deal with it like a physical wound. You wouldn't let a physical wound become infected and start, causing you to lose your arm. Christine is saying, yes, I have a hard time moving forward. The past is always affecting us. We need to work on that. We need to accept that. The degree of how much your past is affecting you is a whole nother issue. That is up to you. There are a lot of people who have caused you pain or people pain, and then they tell you, well, get over it or let it go or whatever, when they don't realize that saying that is also getting them off the hook, because they want you to just forget whatever harm they've caused you and act like nothing's happened. Completely ridiculous and completely contrary to how you heal. You got to deal with how you feel. Okay, you've got to, but we don't live in that culture. We don't live in that society. We don't live in a world where people are saying openly that I'm in pain. Men are one of the most guilty of that. So how do you stop thinking about your past, Janice? Before you can even get to that, you got to get into what is still haunting you from the past. What is still affecting you in the past? And then you'll be able to. Yeah, right. I have a lot of those. So, but Christine, thank you. But you've got to deal with how you're feeling. If there's something in your past still affecting you guys, then you've got to work it through. You got to feel it. Like I've said before, you got to feel it to heal it. If you don't feel it, it ain't going to heal. People don't like feeling pain. And I'm not saying in a masochistic or sadistic way we should all like feeling pain, but we need to identify how we're feeling. Now, great. Someone's trying to help Allison, maybe help her with her self-worth. Allison, I have 6 sisters. We all have envious between us. Great. But I would offer to again, when you're trying to help somebody, you've got to ask yourself, why? What's my motivation here? I know you could say love and all that, but I've seen this with professionals in this field. Sometimes we get so wrapped up in, oh my God, I got to heal this person. I got to fix this person, whatever. And in reality, they need to find that within themselves. So what I would offer to Christine is, you've got to get engaged with her about what is this negative energy between us before you can kind of move forward with it. And this gentleman who took such grave exception with me earlier, please remember, one of the reasons I jump around from topic to topic is because this is a live broadcast. And and when it's a live broadcast working on mental health, people are chiming in with their questions, and this is what the purpose of it is. So I do jump around, and I apologize if that's confusing, but we need to engage with our mental health. We need to look at our mental health like we do our physical health. It's the same exact thing. If you're not working on your mental health, if you're not working on what's affecting you mentally, odds are you ain't working on what's affecting you physically either. So what I would encourage everyone who's watching this, and please may ask me a question or make a comment. If you have something off the board, you want to talk about politics, or you want to talk about something else going on in the world, and we can talk about it from a mental health, psychological perspective, feel free. So Rose is saying you're as sick as your secrets. True. Absolutely. Let them out. Don't bottle them up and make you physically ill. Absolutely. But the problem is, Rose, as you know, I think you and I exchanged a few messages, is people don't like to admit that they are in pain. That's not the kind of culture we have. We don't have a culture. We don't have a society where, specific to mental health and mental illness, people are okay admitting weakness. People don't like that. Admitting weakness is like, and men are notorious for this, we don't like admitting that there's something wrong with us. So we bottle it up and we conceal it. And there's an old adage in this field that says anger is a secondary emotion. What's the primary emotion? Being hurt. Being hurt. So we need to keep working on what is affecting us. So just to wrap up with Janice's question, how do you stop thinking about the past? The way you stop thinking about the past is you go through a period of time of thinking about the past. Okay? Because if you think about it in an exposure therapy model, so exposure therapy is the idea that somebody comes to me and they want to be over there, I don't know, they've got a fear of snakes or whatever, spiders. If I tell them, oh, just stop thinking about it. No, don't think about it. No. We're going to work on just not thinking about that spider. Obviously, that's not going to help. We're going to slowly therapeutically expose them to spiders, to the thoughts of spiders, visual images, and eventually work into being in vivo, it's called, with a spider. So the same thing with issues from our past. If you deny that those issues are affecting you, then they're never going to heal. And one of the things, like I said before, the main thing that affects people's ability to deal with their past, they don't want to admit that it's affecting them. They don't want to. And you've heard this in previous broadcasts, this let it go society, this idea that we should just let go of what's affecting us, ridiculous. It's ridiculous. So again, if you're just tuning in, I'm answering a question about how to stop thinking about the past. You can't let go of your past. You can't forget. The Doors have a great song, line in a song, Learn to Forget. That would be great if we could just forget, but it's not going to happen. I don't know if you all ever saw a movie with Jim Carrey called Eternal Sunshine of the Spotless Mind. Great movie, because all about a psychologist who figured out how a machine where he could extract the memories of his ex-girlfriend. And the movie was all about the chaos that ensued from that. You can't forget the past. Whoever came up with this forgive and forget is the biggest load of BS, because just forgive, work on forgiveness, but don't even think about forgetting, because you're not going to forget somebody who caused you pain. So telling somebody to let go of it and just let it go is ridiculous. Now, does that mean letting it go by default is all bad? Of course not. If I say something to my wife or my wife says something to me that upsets me and it's not that big of a deal, let it go. What's a big deal? Sure, that's a good form of letting it go. But you cannot let go of stuff that is affecting you. Great to see that people are interacting with each other. This is the whole reason why I'm doing this. I want people to engage about their mental illness or mental health, because remember, we all have a degree of mental illness, like physical illness. Nothing to be ashamed of. But back to the whole idea of letting go of your past, you're not going to let go of it. Now, the key is the more you work on it, the less acute it becomes, the less infected it is, the less it affects you. No audio on YouTube. That's not good. Check your settings, Emdr, please, because I'm pretty sure it's streaming. It's streaming. Let me check here. Thank you for that. If there's ever any technical glitch, please let me know. Let me see here real quick. But anyway, with the past, you're not going to be able. Let's see. Check here. No, I got I've got glitch, please let me I'm getting audio on YouTube, so I don't know. I think it's from your end, Irindira. So accept that the past is affecting you. It's okay. You guys have heard me say this before. I've been saying this for 20 years now, working with clients. The it's okay pill. It's okay that my past is still affecting me. I need to work on that. Denying that you have these pains inside of you. Great. Mehmet, thank you. I can hear you. Janie, I have audio. Beautiful. Please, you guys, Mehmet, Janie, ask a question. Please interact with me. Share this on Facebook. So back to that. Everyone is affected by their past. Everyone is affected by their past, okay? We've got some people on here now interacting with each other, talking about these issues. Excellent. This is what we need. We need a society where people are working on their issues. So like I said, just to close out the question, you're not going to be able to let go of being affected by your past until you work on it. Okay. That's the key. The key is you've got to work on whatever issues are affecting you. That is the only way you're going to work on them. And somebody might say, thank you. Christina's saying, yes, we evolve from our past. Absolutely. But how can you evolve from your past if you're not willing to admit that your past is still affecting you? You know, that's the key. People like to just think, oh, I'm over it. It doesn't bother me at all. And maybe some people are, I don't know, because their degrees of emotional and psychological trauma. Not everyone is affected the same way. That's why a lot of these people who are giving mental health advice or telling you this person's a narcissist and this is what you need to do and that's what you need to do. Okay, but again, what's your training? What's your experience? How do you know that's going to help me? How do you know that your advice is going to take me in a direction? And I'm going to do a show on narcissism because that's the hot topic. Narcissism is one of the hottest topics where everyone thinks this person's a narcissist, that person's a narcissist. So, but what I'm encouraging people to look at when it comes to mental illness and mental health is, what's my mental illness? What's my mental health? We can't just blame the finger and people will say, well, no, if you're with a narcissist, you have that's all their fault. Maybe, but being with a narcissist doesn't necessarily mean that you have no issues, that you have no part in the degradation of the relationship. So Allison is saying you think she's a narcissistic person. Maybe she is. I don't know. But again, guys, if you're watching this, please share it. Please ask a question. If anyone is interested in actually being interviewed on this, I can do a live interview where you can text me on this number and we can set it up so that you're part of the broadcast and we're doing a little one-on-one. Because what I'm trying to show people is, talking to someone like me, there's nothing to be ashamed of. We're not we're not Dr. Phil. Dr. Phil is not a psychologist. Dr. Phil is not doing therapy. He's, flamboyant and he's charismatic, and Oprah, pulled him out of obscurity into worldwide fame, and more power to him and her. But that's not therapy. Therapy is you talking things out. I have a couple of my own clients, my own patients, who are entertaining the idea of being on here and talking about what their experiences is, good and bad, just to give people an idea of what this process is. Mental illness is and will always continue to be, in my opinion, the most important aspect of our society. Why? Because our thoughts and emotions are affecting people around us. Thoughts and emotions, beliefs. So before, we had somebody asking about how do I change a faulty belief system, and she was talking specifically about her sister. The belief system is what's crippling this country right now. So I have another question. Do you ever feel like you can't help a patient? Wow, great question, Vinny Vivid. Sorry, I mangled that, but that's a great question. So let me transition into that. Yes and no. So, that's a great question. Do I ever feel like I can't help a patient? No, I never really feel, wow, that's a great question, man. So thank you. I never really feel like I can't help. Hi, Kimberly. No problem. We're still on. I never really feel like I can't help a patient. Sometimes when I'm working with a patient who is really set into their belief system, and what they're looking for is me to just say, yeah, you're right. Your husband's a narcissist, or your mother was a, whatever, or your father, and they just want somebody to agree with them the whole time and not really do some work. Then I do sort of think, like, what is the motivation for this person to do the work? Like, what do they just want to vent? And I'll say to them, so you're looking just to vent. You don't really want to make some change. So one of the things I really strive to work on with people is what's called motivational interviewing. So motivational interviewing is where it's a specific modality of therapy where you're trying to get people to be more motivated. And I'm not gonna lie to you. I'm the sole financial provider for my family, and we're not, multimillionaires by any stretch of the imagination, but money's not my motivator here. I left a career in my early 30s to do something more meaningful with my life. And I went through hell to get here. I lost a significant person in my life. I had to I gave away all my worldly possessions. I went to work at a school making $8 an hour, and that moved into, so what I'm saying is, to follow up on the question about do I ever feel like I can't help a patient, is I want my patients to make changes. I really want them to see improvement. I kind of look at it like I'm like a personal trainer. So if I'm a personal trainer and you've come to me to, work on your biceps or your cardio or whatever, I want you to get healthy. I want you to feel like, yeah, cool, I'm looking better, I'm feeling better. Same thing with me. So I never really feel like I can't help a patient who wants to be helped. But one of the things I need people to understand is I am not the change agent in the relationship I have with somebody. The patient is the change agent. So I don't want them to become dependent on me. I want them to be dependent on themselves. I want them to learn that they are the ones who can make changes in their life. They are the ones. So when you say, do you ever feel like you can't help a patient? It's kind of a mixed, you know what I mean? It's got a lot of different nuances to it, because I want to help the patient, but I'm also constantly thinking about how my interventions, innovative interventions, but how my interventions can help the patient learn to help themselves. Because I tell all my patients that I work with, I don't want you being dependent on me. Sure, it helps me pay my mortgage and all that, but that's not why I'm in this. I want you to become dependent on yourself. So, great question. Do you ever feel like you can't help a patient? The general answer is no. No, I don't. I don't generally feel, I honestly believe everybody can heal. I honestly believe that. The key is getting motivated, doing the work, not falling into the idea that they're broken, that they can never do anything with themselves. So great question. And also, if you're in therapy, if you're working with somebody and you're not getting the results you want, here's a good forum. Talk about like what you need more from the person you're working with. So that last question from YouTube is exactly why I'm doing this, because that's the kind of questions that I'm looking for, is for people to say, hey, this guy's got a doctoral degree in clinical psych. He's got a master's in counseling psych. What's it like to do the work? This is what it's like. You're talking to somebody who is just basically giving you a forum to speak about what's on your mind, and then giving you feedback, and we're processing it, and we're tying it to things from your past. We're helping to dispute your belief system. But one of the things I want, and the reason I'm doing this, I'm so sorry, Doctor. True. I do enjoy helping people. I'm not going to lie to you. I mean, and if I do what I quote unquote get out of this work is that feeling. I enjoy helping people heal. Absolutely. That's why I got into this. That's why I'm, have debt from student loans, and I have all of that, and being an entrepreneur in this society is crazy, difficult sometimes. But yes, I enjoy helping people. Absolutely. So again, please, if somebody has a question, that was an awesome question from YouTube. I don't know if anyone's watching from Twitter. I don't have that many followers on there, but please ask me a question there. So, but getting back to what I was talking about, mental illness, mental health, is something yeah, in a sense I have. Thank you, Christine. In a sense, it found me in a weird way. But mental illness and mental health is such a pervasive problem, not only in our country, but around the world, but specifically in the United States. One of the things that's making mental illness and mental health, or mental health and mental illness, even worse is this polarization. Okay, it's what I call all or nothing, not what I call, but what it's called all or nothing thinking. So a lot of people will say, I'm a black and white thinker, meaning they're either black or white. But that's black and white is actually healthy. Black or white is what we're heading to in our culture and our society. So that extreme form of thinking is why we're going down the road we're going down. The reason people don't deal with their mental health or mental illness is because they can't face the fact, well, maybe I do have a little bit of mental illness. That's not something people are comfortable with. But if you said to somebody, well, do you have a degree of physical illness? Yeah, I got allergies, I've got a cold, or, I got this, oh man, my knee, or I got acid reflux or whatever. No problem. Why can't people be happy? And if anyone wants to answer this, please feel free. Why do you guys think people can't be comfortable with having a degree of mental illness? Anybody? Feel free to chime in. Why can't people be happy or not be happy? Why can't people be okay with having a degree of mental illness? Why? Why not? So I'll put that out there. Feel free to answer. So here's a good one from YouTube. how do you get out of, thank you, Janie, how do you get out of your safety bubble of 12 years? Horrible divorce. To live again, trusting someone to feel love. I feel dead inside. Janie, sister, you got to talk some of that pain out. Stigma, yeah, that's definitely going back to the original question. But just focusing on Janie for a few minutes here. I feel you. Divorce will rip your friggin' soul apart sometimes. I don't know if you initiated it or he initiated it or whatever. But the first thing I would say to you, Janie, is you got to start working on Janie's relationship with Janie. I don't know if this is your first time tuning in, but that's going to be a mantra you hear over and over and over. What is your relationship with yourself like? So just thank you for asking that question, Janie. You're taking that first step right now. You're asking it. You're asking it so other people can see that you're hurting. Nothing wrong with that. There's nothing wrong with showing pain. So the first thing you got to do is make whatever you're going through okay. Okay? The first thing you have to do is say to Janie, it's okay that I'm hurting. It's okay that I'm struggling. 12 years, all of a sudden you're out of your safety bubble and a horrible divorce. That's going to take some time to heal, sister. So what I would encourage you to do, talk some of that out. Get yourself into a situation where you can talk about it. You can make it okay. You can process it. Maybe get into a group where there are other people going through divorce and you guys are all just venting and processing it. Find somebody in the field that you can work some of these issues out with. You feel dead inside. Again, if you and I are working together, these are some of the questions I would be asking you. And it's not to because I'm a sadist. What does feeling dead inside feel like to you? I want you to feel that a little bit. I want you to allow yourself to feel that way. You're not dead inside, Janie. I guarantee you that. What you're focusing on right now is the surface level of pain and trauma that has that has covered up that otherwise sparkly, kind, sweet Janie. You gotta work through that, sister. You gotta stop, even if you feel it. So this is another thing I want to emphasize here. When you're depressed, okay, the depression is pumping out a lot of negative self-talk, a lot of negative imagery, a lot of negative feelings. And then you're identifying with that as though that is really the whole of who you are. You've got to start saying to yourself, I'm not dead inside. Or if I am dead inside, I'm going to become alive inside again. Because I guarantee you, Janie, this. Who was it that said, you can never kill energy? One of the smartest men I know, Albert Einstein. That Janie, that spark of Janie that was in you is still in you, sister. It's just been covered over by a lot of trauma. So you're probably thinking, oh man, how am I ever going to live again? How am I ever going to trust someone to feel love? That is a symptom of the depression. That is a symptom of the trauma you're going through. And guys, people talk about trauma all the time. There are so many nuanced forms of trauma. It's not even funny. And there are degrees of trauma. So Janie, you're absolutely I don't know how fresh the divorce is or whatever, but you are going through a traumatic event. You are in the midst of a trauma, and you have to identify that trauma is going to be pumping out within you certain negative feelings like, I'm never going to love again. I'm never going to be able to trust anybody again. That is a symptom of trauma. So I mentioned before, back in March, I don't know if it was coronavirus or whatever, but I was sick as a mother blanker. I was sick. I had to go to the emergency room twice. I lost 20 pounds. I did a flash will. I transferred all whatever money we had into my wife's accounts. We literally thought this is the end. Thankfully, I rebounded. Still got a little bit of that, post-viral syndrome. Back then, they weren't testing for coronavirus, but I had every friggin' symptom, blah, blah, blah. What were all those feelings pumping out? What was all that sickness, that fever pumping out in me? Dude, you're going to die. You're never going to get better. You're going to leave your wife and son are going to be without you. And I started spiraling because I don't get sick, people. I haven't been sick in friggin', I can't even remember I think one of my friends, and when I was in my program in Hawaii, said, dude, the last time you were sick was when you were here. That was 20 years ago. So that was pumping out in me. So that's what I'm saying. That was causing me to think in a negative way. Janie, hope you're still on. That depression is causing you to think like you're dead inside, sister. You're not dead inside. If you keep reinforcing that you're dead inside, if you keep telling yourself that, you're going to keep spiraling. You're going to keep spiraling down. I am not dead inside. Or if I am dead inside, I'm going to get alive again. We've got to get out of our own worst enemy into best ally. Right now, sister, I'm not trying to come down on you because I feel you. I've been through some epic breakups, not a divorce. So I feel you. But what I'm saying to you, Janie, is talking to yourself that way, even if you feel that way, is going to get you down. Imagine if a friend of yours is going through what you're going through, and you're listening to her, and she waits for you to say something, and you say, "Well, honey, you're never going to live again. You're never going to be able to trust anyone. You're never going to feel love again, and you're actually dead inside." Imagine if you said that to a friend of yours. How would that impact them? Well, sister, you're saying that to yourself. Okay. And I'm not saying, boom, you stop saying it to yourself, but you got to realize that you're saying it to yourself. Okay. You got to realize that you're saying it to yourself. And part of what this work does, there's a form of mindfulness that we help people work with where mindfulness is one form of mindfulness is thinking about your thinking. You become aware of what you're thinking about so you can work on it and be like, whoa, 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 whoa. What am I doing? I'm not dead inside. I am alive inside. You can be both, by the way. Remember we talked about black or white thinking? Be a little black and white, Janie. Let both exist. I'm dead. I feel dead inside, but I also feel alive inside. Allow the equal opposite to exist. Allow that to exist within you. But the main thing you got to do, sister, is you got to get yourself into a place where you can talk this out. Okay? So I feel you. You're feeling hopeless. You're feeling like it's never going to heal. And if you keep feeling that, and if you keep telling yourself that, you're going to spin down. But I empathize with you. You feel like, this is never going to get better. Let me scroll down and see if you followed up here. Sorry, I got a little bit of a rant. He did. He left me homeless. I love myself. Great. And Rindira saying she has audio. Janie, no, I have been healing for 12 years, just not frustrating. Just not trusting. Okay, beautiful. So, let me get us here. Thank you. You're welcome, Janie. Great. So good. The fact that it's still affecting you after 12 years, you got to make that okay, sister. You got to say to yourself, it's okay that it's still affecting me out of 12 years. I accept that, but now I got to work on it. But trust, we could talk about that for a while. I would ask you, what is trust? People have these ideas that trust is black or white. You either trust someone or you don't. Hey, who said that? There are degrees and levels of trust, people. If you paint yourself into a corner that I trust or not, you got to break it down a little bit, okay? You got to break it down a little bit so that you can work it through. Now, I asked a question before about why people, we don't accept that we have a degree of mental illness. And so, Janie, I hope that helped. Feel free to send me some private messages. We can, talk, or I can encourage you in other ways to get work on it. But the main thing is you got to work on your belief system about trust. Okay. So let me scroll back up here a second ago. Somebody asked a really good question. Okay. Veni Vivid, who asked a question before, is asking me, in those times, do you talk to another therapist? Absolutely. We have people that we do case consultations on. I have a mentor that helped me when I was in my doctoral program that we'll schedule some time to talk some things through. Absolutely. Getting feedback from another therapist is a great way to do it. I'm constantly working on myself. So I've got my game, so to speak, at a level where I can work on what's affecting me within myself because of the tools I've learned from doing this work. I do a lot of self-therapy. I believe in the power of self-talk. Not only what I say to myself internally, but talking out loud to myself. And people might say, well, that's friggin' crazy, dude. Try it. Try talking out loud to yourself, and not obviously not around other people, because people, there's that stigma, but the idea of hearing yourself talk can be a very powerful thing. So great question. Keep them coming. Let me go down here. Let's see here. Toby, hey Toby. Toby saying we associate mental illness with more severe cases, like what is seen in movies. Amen. So people don't want to be identified with that image. Absolutely, and that is the more severe forms of mental illness. Absolutely, but that's like saying that only coronavirus people who are intubated on respirators. That's if I have any symptoms like that, I'm going to deny that. No, they're extreme forms of mental illness. And you're right. That is what, you're welcome, Kimberly. That is what is affecting our culture's ability to talk about mental illness. So guys, please share this if you're watching this. Great, Toby saying these videos are really helping to change his internal narrative, what he's talking to himself, how he's talking to himself, how he's working on things. That is what we need to do. We need to own that there are issues within me that I need to work on. If I don't work on them, then they're going to get progressively worse. Okay, so Arindira, I guess, has sound back. Beautiful. She's saying it took years for me to forgive my mother for the emotional abandonment. Wow, yeah, I feel you. It affected my security. I forgave her and forgave myself. She saw the molestation and didn't do nothing. So Arindira sounds like she's had some sexual abuse in her past. I've worked with hundreds, thousands, if not, of people who have been sexually abused. So this is a classic example. When you are molested by somebody in your family, like a father, an uncle, and then you're angry at the people who didn't protect you. That's a very common thing. Great to hear that you've forgiven your mom for the emotional abandonment and how it affected your security. So I would ask you, Arindira, if you're still on, share with us how you healed, because I would bet that you worked on it. You talked to someone. You didn't just let that pain, because I'm telling you guys, sexual abuse, it is so pervasive in our country and worldwide. And most of the time people aren't talking about it. Most of the time people are just burying it away, knowing it's there, but no, I don't want to look at it, because if I look at it, it's going to overwhelm me. It ain't going to overwhelm you if you're working on it in a professional setting. So Arindira, tell us how you healed. Share how you got to the point where you feel that you've forgiven your mom for the abandonment. And what is forgiveness? That's a whole nother question. We could do a whole show. What is forgiveness? What does it mean to forgive somebody? Does it mean, oh, I forgive you, and then I'm going to keep you in my life and have you still hurt me? Is that what forgiveness is? Would you guys think I would recommend, if I'm working with a rape survivor, and if I'm working on helping her or him heal from that trauma, do you think I'm going to say, oh, forgive your rapist, go have lunch with him, hang out with him? Of course not. I'm not going to encourage people who have been hurt by people in their life to forgive the person and continue to have a relationship with them. Now, if the people who have hurt them are working on themselves and owning it and not doing it over and over again, because that's another thing that happens in abusive relationships. You're told constantly, you can't forgive people and you're not over it. Well, maybe and I've heard this from clients over and over, maybe if the person who caused the pain is not continuing to cause the pain, maybe you can have a relationship with them. But this is classic abuse talk. The people who have hurt you or abused you will say, it's you. You just can't forgive it. You just can't forgive and forget. Sure, I'll forgive. Maybe I'll work on forgetting if you stop friggin' reminding me of everything you've done every time we interact with each other. And sometimes you've got to create boundaries. Good. Toby saying, sometimes forgiveness does not mean automatic access. Absolutely. Absolutely. So, all right. Well, look, yes, all of these are great answers. It's taboo to have mental illness. There's something wrong with having these issues in the past. Benavita, I'm sorry, you know who you are. What is the best way to find the right therapist? Excellent. We have different expectations, and there are so many therapists, and yet it's hard to know that after at least one session. Beautiful question. Okay. Best way to find the right therapist. What do you guys think? What's the best way to find the right therapist? You got to look for what's called goodness of fit. Do I feel this person can help me? Number one, go into it with a list of goals. Ask them, do you have experience in this? Do you have experience in that? These are my goals. This is what I want to work on. How are we going to chart progress? Find out what you want out of therapy. Sometimes people just want to vent. Sometimes people just want to vent, and they just want a situation where they can talk about what's on their mind without even making changes. So you've got to figure it out, what you want. We have different expectations. Exactly. What are your expectations? Are they congruent? Are they lining up with what your therapist is? And there are so many therapists, true. And yet it is hard to know that after at least one session. Well, what I would offer to you is go into your first session prepped for what you want to get out of the process. What do you want to get out of the process? If I'm a personal trainer and you come to me, your goal may be, well, I just want to get physically fit. Okay, well, we'll work on that. But maybe you want to work on your legs. Maybe you want to work on your biceps. Maybe you want to work on your chest, whatever it may be. It's the same thing with this kind of work. Figure out what you want to work on. If you don't know what you want to work on, ask them. What's your experience? What's your orientation? By orientation, I mean there's some people who don't believe in other forms of therapy. There's some people who stick rigidly to one model. Some people are behavioral therapists, meaning that they focus on your behavior. Some people are life coach advice givers on how to, and I try to stay away from that. If you notice, everything I'm talking about tonight is mental, psychological, emotional advice, how to work on your issues. If I have a client that says, hey, can you give me some life coaching advice? Sure, I can do that, but I make it perfectly clear you're asking me to do that. So find out what you want to get out of the process. Okay? Well, again, I didn't know you could do that. See, you learn something new every day. I can actually show people what question it is. Wonderful. So learning this new program. So like I said, if anybody wants to be a guest on the show, send me a text on this number and we'll communicate about it and we'll try to set it up. What I want to try to do is I want to try to engage, show people what therapy is about. What is this about? So Janie's saying, I was sexually abused as a teenager, raped twice. Wow. In my 20s, in my life of 57 years. I had Emdr. Beautiful. Tell us how that worked for you. It helped me with all the flashbacks and had to relive it to regain control of my life. Exactly. You had to be exposed to it. That's the key. You were exposed to it in a therapeutic way. And I hope that it helped you heal. Janie, sounds like you need to do a little bit more work on the trusting piece. Maybe it's you that you're not trusting. Maybe you're projecting that outward on the people around you. But thank you for sharing that. That's a beautiful, your ability to share this in an open setting means, hey, what's the difference if I'm listening to a broadcast on dental health or physical health, and I share that, yeah, my gallbladder hurts, or I had an abscessed tooth, or whatever it may be. Why? That's exactly what we need in our culture. People just talking about, I don't know what that means. Please stop talking, Janie. But anyway, about Janie, the point is we got to keep talking about it. So anyway, I got to break off here. When I go over an hour, a lot of this sort of gets diluted when people play it back. But in closing, please, guys, share this on your pages. Please make it clear to people that you are okay with showing this, working on your mental health, mental illness. Please like this page. I'm going to be moving at some point to only letting people who like the Facebook page post comments to make sure I manage that. If you're catching this at another time and you take exception, if you're a coach or if you're somebody who likes giving people mental health advice and you come at me in a very aggressive way, like this gentleman I talked about earlier, I'm going to come back at you. I'm going to challenge how you feel that you can denigrate 20 years of clinical experience because you feel that you know what's right and what's wrong. Show me your resume. Show me how many clients you've worked with. So anyone posting clients and posting comments, do it in a way where you can engage with me. Come on here. You don't like what I've said? Shoot me a message. Here's the way. Text me. Say, I want to come on and I want to debate with you about what I think helps people. Let's do it. Bring it on. But don't just post stupid crap thinking I'm not going to ban you off this page. If you come at me in that way, I'm going to ban you. If you come at me in a way where you say, well, Dr. Walker, I don't think you know, blah, blah. Let's engage. So fair warning if you're watching this, okay? Guys, thank you so much for all your questions. You can always text me or send me messages after the videos have aired, and we can talk about things live or however. Janie, thank you for sharing. Please feel free to send me. I want to just see here. Okay, so Kimberly's saying, interesting question before I log off. My husband and I had a deep conversation today about the amount of rape accusers that lie. I said it's extremely small. He said it didn't matter. Interesting. We could get into that, but Kimberly, maybe is that coming out of something within you? I don't know. Maybe it's coming out from something within him. Just want to make sure that anyone. So anyway, okay. Well, you're welcome. Thanks for your time. I'm going to log off here, guys. If anybody wants to send me private messages or whatever, feel free. Thank you for participating tonight. Thank you for accepting that whatever degree of mental illness you have is okay. Thank you for that. Please share this. Please encourage people to work on things. Don't fall into this idea that you have to be this or that. Thank you, Allison. Therapy helps. Talking things out helps in a professional manner. Therapy has excellent. Don't fall into this idea that you have to be all or nothing. I'm going to do a broadcast on imposter syndrome in a few weeks or in a few days. I would encourage you guys to look at, thank you, Tina. I appreciate that. You didn't ask a question, Tina. I appreciate the comment, but please, next time I'll be on again Monday. I'm on Monday, Wednesday, and Friday, 9 p.m. Mountain Time. So that's 11 a.m. I may have to knock that a little earlier for the East Coast, but that's 11 p.m. East Coast, 10 p.m. Central, 9 p.m. Mountain, 8 p.m. West Coast. So Tina, please shoot me a question. Something's on your mind. Anyone else watching this after the fact, please engage with your mental illness. Like if I'm a physician and you have cardiovascular disease, please engage with your cardiovascular disease. What does that mean? Don't be eating Burger King, Popeyes, exercise. How much stress are you under? Same thing with mental health. You have to engage with it, people. You have to look at whatever is affecting your mental health like a cut on your arm. If you let it get worse and worse and worse, it's not going to heal. Okay. So thank you, everybody. Please share this. And again, I'll see you Monday night at 9 p.m. Mountain Time. Thank you for all the questions. Talk to you soon. And